It's Monday. This is Mammography Mondays where knowledge saves lives. Hey, y'all, and welcome to Mammography Mondays featuring the Certified Tittologist. That's me. And today we will be discussing what is a mammogram and how you can prepare for it. To begin, a mammogram is a specialized imaging test and a crucial tool in the early detection of breast cancer. And that is because it can detect a quarter size mass or smaller in your breast long before it is felt by you or your provider. Now, a mammogram is performed by a mammography technologist, not a technician. We are not technicians because we earned the title technologist because of what we went to school for. We specialize in mammography, earned that degree. So we are technologists, not technicians. Before we even begin your mammogram, what we will ask you to do is get undressed from the waist up. So, if you can, do not come in bodysuits or dresses or anything like that. Wear a two-piece garment because you will be wearing a gown that opens in the front so we can expose your breast so we can have access to your breast. We do not need access to anything else. Also, we will ask you to remove your deodorant, lotions, and oils, and that is because this stuff can't interfere with the x-rays. Now, once we get done with all of that, you will come into the room, or depending on what clinic, some clinics are set up where the dressing room is right there in the room, and some clinics you have to wait in the lobby and then you come into the room. But anyways, we ask you your questionnaire, and and some clinics go over your questionnaire. So again, depending on what clinic you're going to, you may be filling out your questionnaire and then handing it to the technologist, or the technologist have your questionnaire and then we'll ask you when you get to the room. So, anyways, on that questionnaire sheet, we ask you, how tall are you? How much do you weigh? Have you had any mammograms in the past? And if you have, when were they? Where were they? And what are the results? That is very important because we need those in order to compare your current pictures to your previous pictures. We also ask you if you had any breast surgeries or breast treatments. So if you had any biopsies, if you had any radiation done to your breast, if you had breast cancer, if you had a reduction, if you have implants, etc. We ask you all of that stuff regarding your breast. We also ask you, have you had breast cancer in the past, or do you have family history of breast cancer or ovarian cancer? That factors into your lifetime risk assessment percentage. We also ask you, are you taking any hormone replacement therapy? And these are for the ladies that's currently in menopause or past menopause and they need that assistance to get through menopause. We ask you, have you had any hysterectomies? If you have, how old were you when you had a hysterectomy? Have you had an ablation? Have you had a tubal ligation? Do you have any children? If you do have any children, how many? How many full-term pregnancies have you had? And how old were you when you had your very first birth? That includes stillbirths. We also ask you how old you were when you had your very first period. These are all factors that calculates the lifetime risk percentage. Some clinics do the lifetime risk percentage and some clinics do not. But these questions are mostly similar across the board. Now, we still asking about the COVID vaccine because it still affects the lymph nodes. So we do ask you about when your COVID vaccine was and which arm it was in, but we do not need to know the brand. And a new question that's floating around is, are you of any Ashkenazi Jewish descent? And that is a new question because that particular Jewish descent has a higher lifetime risk of developing breast cancer. Also, once we get done with the questionnaire, we do ask you, do you want 2D or 3D? Again, depending on the clinics that you're at, you may get this question, you may not. And that's because some clinics still offer 2D imaging and some clinics offer only 3D imaging. So that is a question that you may get. Now, once you're done, depending on the clinic, you will be asked to sign these forms. So you'll be asked to sign a history form. You'll be asked to sign a consent for 2D or 3D imaging, and then you'll be asked to sign a consent for implants. If you have implants, you'll also be asked to sign a pregnancy consent form. Again, the forms are not across board. It depends on what facility you're having your mammogram at. But the crucial takeaway here is to make sure that you come in a two-piece garment, to make sure that you are not wearing any deodorant, no lotions, no oils prior to your mammogram. and to make sure that you know where your priors are if you had a mammogram in the past, or go ahead and request your priors to be sent to you. Therefore, you can bring in the priors and the report when you come in for your mammogram. Now, to get started with your mammogram, your technologist will explain the procedure to you, and we will basically position you in the positions that we need you to be in. So we take a minimum of 4 pictures, and I say a minimum because depending on if we need repeats, depending on your breast size, those factors will determine how many pictures we need. But it is a minimum of 4 pictures. Layman terms is 2 front views, 2 side views, 1 breast at a time. So for us technologists, they're called CC views and MLO views, cranial caudal views, and medial lateral oblique views. They're just named based on the direction of the beam of the X-ray. Now, your technologist will tell you exactly what to do, when to do it, and what you should be feeling during that moment. Some technologies are more thorough than others, which is okay. But it's very key that you listen to the technologist and do exactly what they say, because it will make the mammogram a lot easier for you as a patient and for us as the technologist. So, for an example, if I was doing a front view on a patient, I would have to tell the patient to stand directly in front of the machine with her hips facing forward, feet facing forward, turn her head to whichever breast that I'm doing. It's a lot of directions that we have to give the patient in order to get a high quality image. But the most important part is listening to us, but also trying to get the patient as relaxed as possible, because some patients do come in freaked out, stressed because they had a bad experience, or they heard that another person mammogram was a horrible experience, and so they're kind of worked up. So it's up to us as a technologist to get the patient as calm and as relaxed as possible. Now, a mammogram is uncomfortable. It is awkward, but it should not be painful. If it is painful, just let your technologist know. You should not be suffering through your mammogram, and it should not be hurting you to the point where you're about to pass out. And if we as technologists did the little tips and tricks that we try to get you as comfortable as possible, it may be your breast sensitivity. And speaking of sensitivity, speaking for the ladies that still get periods, cycle, menstruals, whatever you want to call them, if your breasts are sensitive the week before your period or the week after your period, or however, whatever time frame it is, please do not schedule your mammogram, because it will be very uncomfortable for you. Now, depending on what's going on with your breast, that will determine if you need a screening mammogram or a diagnostic mammogram. And in a video later on, I will discuss the difference between that. But for now, just know that a screening mammogram is asymptomatic testing, meaning you do not have any breast concerns or you don't have any breast concerns. So no nipple discharge, no skin retraction, no you feeling lumps or masses or anything like that. None of that is going on. Now, if you are having any breast concern, then you need to schedule a diagnostic exam, again a symptomatic exam, meaning that you have breast concerns. So we do compress you, but we do not compress you as flat as a pancake. But what this entails is us just taking your breast, and a paddle comes down, and we slightly compress until your breast is tight and taut. So we will be feeling your breast and poking against your breast to make sure that your breasts become tight. When your breasts are tight and taut, that's enough compression. So sometimes it could be too little compression and we need more compression, and sometimes it could be too much compression. But again, that depends on the type of breast that you have. So just to give an intro to a baseline patient, and a baseline patient is a patient that never had a mammogram before. So my spiel or my speech is, this is your first mammogram, correct? And that's just me confirming again that they have not had any mammograms in the past. Again, I look over their history sheet to make sure they do not have any implants, because that requires a different procedure, not necessarily with the machine, but we need to put in our computer that they have implants, so it's more pictures. but I will explain all of that in a different video. Um, but to go over it, I would say, okay, this is your first mammogram, and we're going to take 4 pictures. During or after those 4 pictures, I will take a look at your breast and make sure I'm not missing any breast tissue, and to make sure I don't need to repeat anything. And then I will explain to them how it is uncomfortable, how it's awkward, but it should not be painful. And if it is painful, please let me know, because I will readjust and try to get you as comfortable as possible. So I also let them know that we do compress, and I need a minimal amount of compression. But again, if they cannot tolerate that compression, they need to let me know, because again, I will adjust to their needs. Um, but I will also explain to them why we need compression in order to have high quality imaging. And then I will ask them if they have any questions about the exam before we get started. And again, I tell them that I will explain every single step to them, when they should take those steps and what they should be feeling during those steps. So for an example, during a CC view, a front view, you will feel the pulling in your neck. And that's just what it is. But once they give consent that they understand, then we start the exam. Now, the exam takes 10 minutes, not even that. The 10 minutes is literally from start to finish, from you getting undressed to you coming into the exam room, to me explaining the procedure to you, to me taking the pictures, reviewing the pictures, and you getting undressed, and me doing the paperwork and scanning in the paperwork and sending the images off to the radiologist. So if you think about it, the mammogram part takes about 5 minutes, depending on body habits, difficulties of the patient, because we do patients that's in wheelchairs, kyphotic patients. Just patients with difficulties is the best way I can explain it. And the compression is like 12 seconds, maybe 15 seconds at most. But to recap, when you come in for your mammogram, you are getting undressed from the waist up. You are answering history questions. You need to bring in your priors or know where your priors are so we can request them for you. And then you just need to listen to the technologist and do the best you can as far as being relaxed. And we will take it from there. So thank you all for joining Mammography Mondays, featuring the Certified Tittologist. Again, that's me. And join me next Monday as I talk about other things regarding mammography. Do not forget to check out my website, www.tittologyenterprises.com. There I sell all mammogram needs and gifts in mammogram awareness, things like tumblers and mugs and drawstring bags and t-shirts and hoodies and everything about your mammogram awareness. These are great gifts for people that have breast cancer or supporters of breast cancer, mammography technologists, companies that imaging companies or companies in general that wants to show appreciation to their employees. I sell it all. So again, just check it out and just tell me what you think. If you all have any topics that you want to discuss about mammograms or mammography or breast cancer awareness, just leave something in the comments for me and I'll look over them and get back with you. And thank you all, and you have a wonderful week.